Hi, I am Dr. Julie Brown, your concussion doctor, diplomate in chiropractic neurology, and fellow in traumatic brain injury. I want to talk a little bit today about concussion and how people end up in my office. I did a prior video that talked about what the definition of a concussion. I want to talk a little bit more about how people end up here. So, common symptoms with concussion. Fatigue. Your neurons are working inefficiently, so you're automatically going to be tired. Your sleep is disrupted, so that could make you tired. Menstrual cycle changes, obviously, in females. Mood changes that either you know, or your significant other knows, or your parents know, or your friends know. Dizziness, headache, new aches and pains. Trying to think, nausea. Nausea, I think, is a form of dizziness that people they don't necessarily feel the dizziness. If your world's unstable, what your brain does is it goes, hey, we're not stable here, let's tighten up the neck to make us more stable. So that leads to neck tightness. Change in appetite could go with the nausea. Let's see. There are so many. Oh, a lot of patients complain about, I can't find the words that I used to. My vocabulary used to be better. Those are the symptoms that bring them in, or their medications have had to change. That usually doesn't bring them in, but that is a common thing that happens because their function has changed. So therefore their application, meaning their medication, may need to change. So we look at the objective findings as well. Maybe their heart's breathing differently. It could be faster, it could be slower, it could have a different rhythm. We take blood pressure on both sides because blood pressure, believe it or not, is controlled by brain, and many people don't know that. I didn't, just through my basic training. Seems something pretty significant to study. Your heart rate, rhythm, your oxygen, your capillary refills. If I do this, does the skin turn red at the same time on both sides? Your arm range of motion, our muscles tightening that shouldn't tighten or didn't tighten before. These are common symptoms and then common objective tests that we get when patients come in here. So I'll continue on in another video where I talk a little bit more about what we do to help these patients. If you would like to follow my website, the link's below. And if you'd like to subscribe to the YouTube channel, go ahead and click right here.